Chairman, for holding this hearing today. First, I would like to add my voice to the list of those concerned of what CMS has decided on restricting coverage for anti-amyloid treatment for Alzheimer's disease. The CMS standard is defined in statute as, quote, reasonable and necessary for the diagnosis or treatment of illness or injury or to improve functioning of a malformed body member. I would like to thank my colleague, Rep. Berrigan, for working on legislation with me to mitigate this misguided decision and would urge that this panel take life-saving measures to address this issue. Administrator Brooks LaShore, I was encouraged to see the President's executive order on competition take on hospital consolidation by noting that this consolidation has left many areas, particularly rural communities, with inadequate or more expensive healthcare options. Can you please elaborate on actions and please be specific your agency has taken to address hospital consolidation?
Thank you so much, Congressman, for your mentioning of the administration's real focus on consolidation. Our authority at CMS on consolidation is really around transparency, and that is what we are focused on, making sure that there is ownership information available to people as they're choosing plans. There are other agencies across the administration with additional authority, of course. That's our focus.
Thank you. Building on this work, I'm hopeful that you'll be encouraged to see these bipartisan bills draft as a way to address the President's executive order by removing incentives for greater hospital and provider consolidation. Importantly, they are built on a foundation of work from the presidential administrations from both parties, nonpartisan groups like MedPAC and academics and think tanks across the ideologic spectrum. Will you commit to work with us on these policies to mitigate consolidation and promote competition?
I will absolutely do so.
This year, over 8 Humira biosimilars will launch in the U.S. with expectations of producing significant cost savings for patients and the healthcare systems. Medicare alone, it is estimated, could save over $2 billion if it had access to these biosimilars. In order for patients and the Medicare program to realize these savings, biosimilars must have immediate access to Part D formularies. What policy actions is CMS taking to ensure that these Humira biosimilars are available to beneficiaries?
We are certainly excited about innovative drugs that come to market, and particularly biologics and other generics. Happy to talk in more depth about what we do to encourage Part D formularies, Part D plans to cover.
I personally welcome that discussion. I think it is so important for patients across America. Earlier this year, I sent a bipartisan letter asking CMS to take action about biosimilars and formulary access. One point that I raised was having CMS update guidance to ensure maintenance change policies were updated to include a broad array of biosimilars. What is the status of this request, and will you commit to doing a thorough review to ensure that biosimilar formulary access is not only permitted, but is also done in a way that ensures patients can utilize them?
We will follow up with your request. And
Thank you. I
a
appreciate
status.
that commitment. Finally, I would like to thank you, Mr. Chairman, and Ranking Member Eshoo for the work that you have done on the MVP Act and echo my support for this important legislation. One of the things that is so important about the MVP Act it adequately is flexible for many different disease states. As a physician, I understand how different some outcomes could be across different disease states. For example, the outcomes that you might measure and the length of time you'd measure them might look different for a gene therapy for muscular atrophy than outcomes for hemophilia. The multiple best price approach would allow payers and states to establish VBAs that could encompass multiple outcomes, including one for diseases where a pay-over-time arrangement is truly the most appropriate way. Can you discuss how important it is that the best price approach capture different types of VBAs in order for them to work across all disease states?
I certainly agree and am excited that the committee is going to focus on outcome-based proposals to make sure that we can make sure that states can afford to cover drugs, that people have access to them, and ones that really support these innovative
Thank you for your commitment to access. My time has expired, and I yield.